and our patient want to be attractive and fresh looking. So the topic Rosé o'clock procedure is about that. Why it's Rosé o'clock? It's who I am. I am a dermatologist from Ukraine, and once we were sitting with my friends, with girls, and they asked me, Vlada, but now we are drinking rosé, and how to be such a fresh and such attractive, etc., etc., but without rosé, how to get such a color of the skin and to be that we have after that and after when we speak to each other, etc., but without alcohol. And I decided to call these procedures and to this webinar Rosé o'clock procedures. How to get our patient very fresh look and without any downtime, because now patients also don't want to come very often to our clinic, and also after our injections or equipment don't want to be at home for a long time. So from all that I have from before, I also founder of our charity organization in Ukraine, Zagrava, and we help, of course, free of charge to our people who suffered, civilians and military who suffered from war. And today we also will talk about polynucleotides, and of course, in treatment of scars, polynucleotides play one of the most role. Regeneration, because when we talk about natural effect and how to achieve that, it's always about regeneration. So this is the process of replacing of human cells or tissues or organs to restore or establish their normal function. So that's about their own sources of energy and all materials that cells have inside. And we know that regeneration and regenerative process can be from two ways. One can be from negative stimulation, when we damage tissue, and after that, in response, our tissue will give us regeneration. Or when our tissues has a deficit of some stimulus and some products, we can inject some regenerative agents and also will start that cascade of regenerative reactions. So both of these projects are programmed and controlled with equipment, with lasers. We know the length of wave. Also, we know the length of needle if it's microneedling. Also, we understand how work our injectable products. So, regenerative agents, which are mostly researchable, and on PubMed you can find a lot of work about that. It's a polynucleotide, and actually in combustiology with the polynucleotides, they have maybe 25 years of history. And before that was animal origin or even human origin from human placenta. Now, luckily, we have another origin of polynucleotides. Also growth factors, synthetic or biological autologous, also stem cells, hyaluronic acid, and all others. From the new one, it's exosomes in dermatology and trichology, but also all of them work for regeneration. So, of course, and I underline it in all my lectures, that male and female demands. For men, it's important to look fresh and attractive, and nobody should see that something done zygoma or mid-face or something. And if we do botulinum toxin, it also should not be so visible. So some mimic should stay. For women, it's look younger and more beautiful. Because actually, I always tell that women made and make makeup for mostly others. And when we have some clothes and some jewelry or something, also some women will estimate us as a women. Yes, because when I ask, for example, when you do makeup, for whom you do that? So, oh, of course, for myself, I don't depend from others and others' opinion. And okay, so when you are at home or when it was COVID, do you do makeup? Actually, no, but if you do it for only for yourself, why you don't do that when you're stay at home? It's a question. So we are depending from opinion of other people. Uh, so why Rosé cloak with injectables? And today we will talk about skin quality and attractiveness. In that part from Pluryal family, we will talk about polynucleotides and its silk and densify and how we can improve appearance and in which method, in which protocols, how we combine it with mesoline range, with vitamins, Meyer, also growth factors, of course, with booster. And booster, I would say that's maybe this year it's 10 years that product exists in Pluryal family and still and work very successfully. And the new range, it's bio fillers, bio sculpture, bio classic, and bio volume. So, about attractiveness, especially women attractiveness, how women attract men, and men answer that from external features, that's body. Let's be, honest. Also, walk, and on that position we can influence. It's eyes and look, it's a femininity because with fillers we can make face more masculine or more feminine. Tenderness, sense of measure, and actually it's also the sense of measure, especially on face. It's also very important. And smile. Last week we talked about lips and lips correction and what we can do with dryness, etc. Today we will talk about skin quality. And of course, in sexuality, it's intellect, so we should attract not only by external features, but external features are on the second place. Why polynucleotides are for Rosé clock procedure? Because it's always about skin color. The healthy skin color attracts and like reflect that this person has very good health. So for glow, color, and hydration, because dry skin, we understand that it's not so healthy skin. That's why we have a lot of illuminizer, highlighters, etc., just to give our skin glowing effect. So with polynucleotides, our patient asks us, okay, we know what is hyaluronic acid, but what is what? They sometimes even cannot pronounce polynucleotides. So I call it also Rosé clock and Rosé clock procedure, and that's for your healthy skin. And the first is collagen stimulator and long-lasting effect. Also hydration, not so quickly as from hyaluronic acid, but also long-lasting. And if it give us very good color of the skin, and also vascular effect, because that enhance the tissue oxygenation and also influence on the vessels wall. So we inject it for pale skin, for vessels, but also we inject it when that's a erythematous stage of rosacea or cuperosis, because it normalize function and it influence on, hello from Brazil, and it also influence on the vessels walls, so make it harder, and also by anti-inflammatory effect also will reduce that unnecessary redness. Also polynucleotides, and with the Pluryal family, that HPN technology, so high purity nucleotides, that densifying effect. Of course, we will talk about collagen, because in cosmetology, in aesthetic medicine, we should give that thickness of the skin and that lifting effect, and but not only fibroblasts are the target for polynucleotides, but also that proliferation of human preadipocytes. So when we inject, we understand that we will influence on preadipocytes and also on adipose tissue, and it depends on the concentration, and it can create lipogenetic effect, or after that preadipocytes will become that fibroblasts from the fibroblast differon. It depends on what our skin needs: volume by adipocytes, by fat, or by collagen. So polynucleotides normalize function. Also, it increase anti-inflammatory cytokines, so we use it in post-acne and in rosacea conditions. Also, antioxidant effect, it how patient will see it on micro level, it improve the skin color. And how it acts, actually. There are two ways of action. One is on A to A receptors, they stimulate collagen production, and also influence on angiogenesis, so that also will give us regenerative effect, especially on traumatized tissue. That's why we can do many multiply injections, and it will produce the regenerative effect more. And the second way is salvage pathway. So that's the quickest result, but also faster tissue regeneration, that replication of with the DNA synthesis. So it also normalize functions by in quicker way when there is a massive traumatizing. So we need new cells, and that fasten the replication of DNA. In general, the effect from polynucleotides It's hydration because of vessels and because of tissue oxygenation, fibroblasts growth with synthetic and proliferative function, so that producing of collagen stimulation, also antioxidant effect, anti-inflammatory, and also DNA repair. So the target for polynucleotides, it's not only fibroblasts. Yes, it's on the first place, but also adipocytes and preadipocytes. It's a lipogenetic effect. Also melanocytes, because it's reduced activation of tyrosinase, keratinocytes, and we also understand because of their DNA synthesis, endothelium of vessels, and we understand that it will be effect on vessels and that hydration, and also immune response, because it also acts with the Langerhans cells. Also was studies that with ultraviolet, when we inject fibroblasts, and it will act by salvage pathway, after injection will give recovery of fibroblasts. And also the concentration of 20 milligrams will reduce quantity of metalloproteinase. So the degradation of protein glycans will be a little bit slower after ultraviolet. And that's also important. In practice, we can prescribe polynucleotides 2-3 weeks before active sun and after 2 weeks after active sun, because now it will be summer vacations in some countries, hope in Ukraine also, and we can in that way also make the recovery to our fibroblasts and save collagen after ultraviolet. Also, that polynucleotides and preadipocytes, we understand that it's very important for stromal vascular fraction and also for mesenchymal cells. So that injections of polynucleotides stimulate proliferation of human preadipocytes. And we understand that's important for future fibroblasts or for future adipocytes. Now, here is the portfolio for Rosé clock. That's densifiers filler beer, and mesoline range. So, what about products? We have Pluryal Silk. It's one of my favorite products, and I combine it in many procedures. From Vietnam, yes, Venezuela, yes, hello. So that's a more liquid product. It will not stay that popular for a long time. Actually, after 15-20 minutes after you inject populars on the eyes, that completely disappear. So silk, it's a pure polynucleotides. With composition of 15 milligram in the syringe. And indications, it's eye area, dark circles, also sagging and drooping skin, also crossfits, that tear trough, but also we can work because syringe contain 2 cc, so 1 cc it's around eyes, and 1 cc it can be perioral zone or neck. So 2 treatment in one syringe. And here is some results after a course of procedures every 2-3 weeks on the eye area, and the course is 3 procedures. And the effect for patient in elegant way age, when we combine in one procedure Pluryal silk and bioclassic with the cannula. And now that will be a video. The first is and the second will be silk. So now we will do procedure of correction of periorbital zone, because we understand that in the total and whole appearance sparkling eyes, it's very important for general attractiveness. Now we will correct tear trough, because we see that here is volume enough, but this special 2 centimeters of tear trough is not enough. We see here depression. So we will fulfill tear trough with Pluryal Classic, and after we will work with polynucleotides with Pluryal Silk. So now our entry point will be under the lateral sousp, like a support for zygomatic ligament. Breathe. Entry point, and now we will do our injection till the bone, and our patient can feel a little bit. We are standing on the bone, and now we will move. But before, I recommend to do a little support, especially for very smooth movement with our cannula. 0.1, and after we are sliding on the bone, and sometimes it's sensitive because we are near infraorbital nerve, which is sensitive nerve. So now we start to inject antegrade. I'm working with a 22 gauge cannula and injecting antegrade, because with the product we work slightly and we see where is our product and where is the fulfilling effect. Okay, and now again, so we see slightly here with antegrade movement before pushing product, and after go with cannula. Now I go retrograde and fulfilling 0.5, just little by little. Yes, 0.5. The elasticity and cohesivity of the product allows us to create such a natural result with fulfilling of tear trough. Sometimes we can see here expressions of the vein, but it will disappear in one day.
And now we will work intradermally, very gentle and very tender, small papulas, papula by papula. We can work with skin, and we know that skin here is very thin and we need to make it thicker, so we stimulate the collagen production, we stimulate with Pluryal silk hydration, we decrease dark circles because we improve circulation and also vascularization. So this is a pure polynucleotides, and you see that the name silk, and it's very gentle fluid, and here we don't do any anesthesia with patient. So this is a stimulating procedure. We work not only infraorbital area, but we also work supraorbital, because we understand that we need very dense tissue here, and not only decreasing wrinkles, but because of collagen stimulation it will be lifting effect, and also decreasing these small fine lines and small wrinkling. One syringe is enough for periorbital and perioral zone, because here is also very many fine lines, so we can improve the quality of the skin also in perioral area. Breathe. 1, 2, 3, and here we work with dermis and hypodermis, with fibroblasts and with preadipocytes. Breathe. And here also, and you see that my papulas is intradermal and in hypodermis also. Perfect.
Okay. So I see that some questions about hair treatment. We have a webinar about hair treatment, about diffuse androgenic alopecia, about seborrheic dermatitis. So we can also during summer give that and explain all differences in between products, and also the protocol also for hair transplantation. That also 1 hour webinar on that topic. So that's the no risk of swelling. Silk never gives swelling. And that's the preference. It not contain hyaluronic acid. It's a pure product, so no edema, never edema, and that papulas also disappear in 15-20 minutes, especially if you have that hydrogel patches. So after procedure you can put it and almost nothing. So that's good. But also we have one product with hyaluronic acid. So when we use filler and silk, filler is on the bone, silk is intradermally, that's great also in one procedure. Of course you can do, for example, two procedure with silk, after on the last you can inject in 2-3 weeks your filler. It's also possible, but now patient want at once and combine as much as it's safe and will give good result. So these two you can combine. So with hyaluronic acid, with free hyaluronic acid, of course, hyaluronic acid will give us quickly a result. So why not to combine these two materials? And actually, we have in our practice Pluryal densify. And how we work, for example, with scars, as I tell you about Zagrava, how we combine it with traumatic scars treatment. So here is one video that botulinum toxin with mesodilution, and we work just in the border of the scar, just to reduce that tightness from the muscles also. And we work also intradermally because it reduce and a little bit suppress VGF. Also, that the second video, several passages with laser treatment, with fractional resurfacing, and also we combine it with polynucleotides. So the result after 3 months is quite good. And during WC, that was a SCAR session, I was a co-organizer and present also our treatment. So polynucleotides also very good in SCAR treatment. So Pluryal densify. It's hyaluronic acid 20 milligram non-cross-linked. So that's there will not be a mistake with the depth of injection. Also, polynucleotides and concentration is higher. It's 20 milligram in the syringe, and also mannitol. So your hyaluronic acid will stay longer. And if you will do very big populace, very superficial, it will stay maybe till 3 days, and on neck 3-4 days. So I prefer to inject this product by boluses, pinch the skin and inject by pyramid technique. So you work with preadipocytes, which is in subdermal tissue, and you work with the fibroblasts and also with vessels. And it will give you a very big like hydration effect, and patient will feel that. That's great. So the first is dehydrated skin, aggressed skin, skin rejuvenation, but not under eyes, because this product, yes, it will create edema, especially if you will inject in malar fat pad. Oh yes. So for 2 weeks, patient will not be satisfied. With silk, it's a direct product for this zone. You can work with all over the face, but not in this area. Also, you can work with the neck. Why not? Also with the hands, with the scars. And that was also combined treatment before after with densify, and actually here was a little bit of plurial contour on zygoma. Now another technology, also densifying, but another technology, matricial 3D technology. So what is this, and why it calls like that? Yes, it also creates 3D matrix with three hyaluronic acid, and also the quantity of BDD reduced in 3 times. So it creates that matrix, and that's hyaluronic acid with high molecular weight, with medium molecular weight, and free hyaluronic acid. So yes, it's like a 3D matrix with all so to use the silk all over the face. All over the face, yes, why not? Especially when it's very, very thin skin, asthenic patient, and she tell you, tomorrow I don't want any papula, etc. Yes, why not? And that's you want to work with rosacea, but without any after papulas. Yes, you also can use silk. Why not? So with this technology, there are several products and residual quantity of BDD. So we will have intensive hydration, yes. We will have biostimulation because we understand that our fibroblasts response on biostimulus, biochemical stimulus, and biomechanical stimulus. And also it will work as a restructurizant. You can add a little bit of volume if you need that from biosculpture, bioclassic, or biovolume. It depends on which volume you would like to add. So restructurization. About biosculpture, because it's very interesting product, and last week I give a webinar about how to use biosculpture in lips, because it contain free hyaluronic acid with low molecular weight for hydration. So not only reshaping, but actually not so much reshaping with biosculpture. You can underline your natural shape, etc., but also you can work with the face. Bioclassic, and it has 7% of free hyaluronic acid, so biostimulating. And you can work with face, with tetraph, with nasolabial, mild nasolabial folds. Uh, Sometimes I also, as an official webinar from Pluryal, sometimes I use it in off-label way with mixing with mesoline products. And on my workshops, I show that how to use. It's a great product with free hyaluronic acid also, and volume. If you need really volume, but not so big like a sculpturing or so sharp volume, soft volume you can achieve with the bio volume product, but also you can work with lips. If you want really to increase lips and your patient asks you, or your lips is really, the tissue is like empty, so you also can work with bio volume. With tetraph, yes, and it will widespread in that time. In this case, very good. It not create any additional volume and not give any correction. Mode, it's modification, so the percentage of modification, so how much of BDDE is added to the product. So that means mode. So for tetraph, also booster. We tell that it's like a cross-linked, but with glycerol. So it's not BDD, but if you will inject superficially papulas, they will stay till 4 days. So glycerol preserve the hyaluronic acid from quick biodegradation, and also glycerol is a very, very good antioxidant. So high percentage of hyaluronic acid, very dense product. It's not so plastic like a filler. And I like to work with this product once per 3 weeks. Course also is 3 procedures. And I like to work with the bolus technique or with the cannula. With cannula, and now I think that we will see how to work with cannula with the 5-star technique, 22 or 25 gauge cannula with 5 directions. Actually, you can have more rays than 5, but in generally you work subcutaneously, not till tetraph. If you work with the biosculpture, for example, not till the real medial canthus, but you stop already here. And now that will be video, and I will close the window because it's really, really raining. Okay, now video. Uh-huh. So can you tell me about filler? Filler, what is this, syringe or single filler, single phase or okay? So monophase or yes, monophasic. Yes. So that's the entry point. We ask patient to smile, and we see where is the highest point on the cheek, and that will be your entry point because you go line retrograde, and all your rays will be in this point. So for slight volumizing, to give the apple of the cheek very natural, also to support and to create that lifting vectors, you can work with biosculpture, you can work with Pluryal booster, you can work with Pluryal densify also. So that, and after I finish also with the silk under eyes, that's why I tell that I love this product and to combine it with different, different purposes because she has dark circles and so about A to A receptors, yes. So the main is to stimulate collagen production, also angiogenesis. So we work with VGF vessels, endothelium growth factors. We normalize that function. Also, that receptors give us anti-inflammatory effect, so that's the main from A to A receptors. The second is a salvage pathway. That's a faster regeneration. And yes, that was can be one and one. So one biosculpture one side, one biosculpture other side. With the densify, you have 2 cc in the syringe, so it's also economically even rational. So one and one, that also will be good. So the next, and how we can combine BioVolume, BioClassic, and Booster. The first, always to see what we should improve with fillers, because when we will do all that papulas or boluses, it will create edema, and of course, after with fillers, we can see almost nothing. So the first is fillers, deep boluses, or fulfilling with bioclassic, and after boluses subcutaneously replaced with the booster. And we and here is the results. So that's the range of mesoline products. With the mesoline for Rosé clock, we should talk about all products because it's a big range of mesoline, but all these products are green serum. So, and we know what is the green fillers, etc. It's a very good trend now. Concentrated, also innovative, and almost all 2-3 years in mesoline range appear the new products, and it's 3R: regenerate, regulate, and reshape. We can achieve that effect with mesoline range. For regeneration, it's Pluryal mesoline refresh. For regulation, it depends what we want to regulate. It's a hyperpigmentation, it's sebaceous glands normalizing function, or it's antiox also for both, and reshaping direct and non-direct lipolytics. And tight. With tight, we work with pores and with the muscles. So, about skin collagen. Uh, yes, it's one of the main extracellular protein, and type 1 is the 80% in our skin, produced by the fibroblasts, and the third type of collagen go and represents along the first type, and it's around 15%. So why this slide is important? Because the essential and in collagen production, in collagen building, three amino acids are very important. It's glycine, proline, and hydroxyproline. And we understand that it's a big collagen fibers. After fibrils, after collagen, like a triple chain, and that chain contain that three amino acids. So if our product contain that amino acids, it will be not only for stimulation of fibroblasts by hyaluronic acid, but also we feed our fibroblasts to produce the collagen type 1. It's very important. And the role of collagen, of course, we see, and we always say, oh, you're losing collagen. Oh, with menopause, you start to lose 5% each year, and etc., etc. So, collagen is the main connective tissue health and mechanical properties of the skin. We understand that and we see that. And also, it's vital for strength, regulation, and regeneration of tissue. That's why it's so important. And of course, the quality of collagen. So the fibroblasts are sensitive to physical tension. That's why all massage, Ikun, LPG, etc., because it's always for straightening, stretch it straight. And it also gives some stimulus, but also with biochemical stimulus, so signaling pathway. And that's also not only, of course, polynucleotides, many types of agents, but also biochemical. Here is the collagen stimulators, because something is much more for regeneration, some is much more for collagen stimulators, just directly to fibroblasts. In mesoline range, we have products which stimulate, regenerate, or reshape. I start from tighten, stimulate, and protect, and we understand that DMAE, it's a precursor of acetylcholine, and if we inject it into the muscles, it will make the contraction of muscles, especially levator muscles. We need that. Silicium, it's also very important for tighten collagen, panthenone, ferulic acid, and minerals. So we can use it all over the face superficially. We can inject it in our levator muscles, and we also can use that as an acupuncture product. It's itching, and sometimes patients even tell that burning. So just tell your patient that she will or he will feel that. In each point, it's around 0.1, 0.2 injections. Here is the combined treatment, tight with roller. At the first, I do full filling with the classic with lines. After, just across that, I do boluses with booster, and after the third part, it was roller with the tight. Also, you can use it for face, for boluses with booster, and after with roller with the tight. It also reduces pores for oily skin. So that shine. Shine also one of my favorite product because it always give fresh result, and in Rosé o'clock that's very important. It's vitamin C, inhibitor of tyrosinase, acids. So it's for homogeneous relief also because it contains acids. Also for like a flash effect when you would like to quickly improve the color of the skin, and also for even tone from hyperpigmentation. And here is some results from hyperpigmentation. We understand that it's very long treatment, if it's especially it's mono treatment, but it's very effective. Once per week, we can use that, or if it's a roller, it can be once per 2 weeks, or dermapen. It depends what you have. Also, with refresh. With refresh, it's a hyaluronic acid in a vial. It's vegetal stem cells. It's also DNA, and actually, it was the first polynucleotides in Pluryal family, and it was already maybe 12 years ago or maybe more. And vitamins for regulation of function. And we can combine in one treatment 2 or 3 products, not in one vial. And here will be a video. Yes, that will be a video with, okay. Video with 2 products. That's wrinkling type of aging with very thin skin, dehydrated skin with wrinkles. It's not very deep wrinkles like with deformate morphotype where the skin is very thick, but a lot of small wrinkles in perioral zone and periorbital on the neck. So to work with refresh will be very good. You see that she has no additional like bulges or malar fat pad or something, but a lot of wrinkles. And with refresh, you can work with line retrograde technique just under the wrinkles, intradermally or a little bit subdermally. It depends on their area. And patient has no anesthesia, so but refresh, it's not painful product. From all, it's only tight and shine. If you inject deeply, it's itching because you understand shine has acid. So, and we mark here because sometimes patient comes and you see that perfect shape of the lower third, but she tell, okay, doctor, but look at me when I do like that, and you see how many here is folds. And you also can inject here and all over the face. And here are some papulas, intradermal papulas with refresh. Also retrograde, line retrograde. Now we will do nappage with shine. I like to finish with nappage with shine. It's not only about hyperpigmentation. And you see here is a deep nappage. I don't remove the product. I always make the infiltration. It's in intradermal and on superficial application always, and a little bit deeper in the pigmentation. So you need around 4, 6, 8 treatment. It depends on the hyperpigmentation, on the etiology of hyperpigmentation with shine. And I combine it as a superficial treatment. You can inject, for example, silk, and after finish with shine. And actually you can use 1.5 or 2 milliliters of shine. It will be enough all over the face. So that's very, like, I would say, economic product. Vitamin C, inhibitor of tyrosinase, acids. So that's very, very fresh result. Also, all over the neck, it also will hydrate and regulate functions. Mhm. And I call it red carpet or Cannes procedure, like you on the Cannes festival. And the first is in one session, superficial peeling. The second with cannula, because you shouldn't have any downtime after treatment. You can inject booster or densify with the cannula with 5-star technique. After, you can take Mesoroller zero point 0.5 or Dermapen and work with shine on the skin or make that nappage. And after, I like to put cold hydrogel mask. So that's great procedure. And on the next day, your patient will be like a star. So for different ages, it's of course different protocols. For young patient, it can be polynucleotides with shine. For middle age, it can be fillers. Also skin quality with mesoline or with biosculpture. And of course, for elegant age, it can be any other combinations with threads, with polynucleotides. Also, if it's hyperpigmentation, it can be antiox or shine, it depending on the skin type. Oily or dehydrated or dry skin. So for Rosé o'clock, and patient remember this name, because polynucleotides for them it's very hard to to produce, and they like these procedures because it gives a long-lasting effect. And in one procedure, I like to combine polynucleotides and HA. It's a filler or it's a biosculpture or bioclassic. Also peeling and meso in one procedure, superficial peeling. And after meso, depending on its post-acne, oily skin, its hyperpigmentation or whatever, also filler and meso, and sometimes I mix it in one syringe and inject with the cannula or with the needle. It depends on. Also for Rosé o'clock, other procedure with equipment, also why not. And in conclusion, so it's a regenerative concept. So we regulate function and we restore function or establish the new cells. It's this all these products are green, suitable, and environmentally responsible. So that's bio and bio sculpture. It's even sounds very good, and for patient also. After our procedure, our patient look good, fresh, and attractive, and it give us quick result, but also long term result. And it also can be a procedure for red carpet. So thank you very much for your attention, and from Ukraine with love, like always. I think that in 2 weeks I will be in Jordan on the Congress. Thank you very much for your attention. And here is my Instagram of my clinic, and also my mail. If you have some questions, don't hesitate to ask. And thank you for your activity today. Thank you. Thank you. Bye.